Distilled spirits and wine are frequently consumed for social, cultural, and culinary reasons, but they carry significant risks for people with gout or elevated uric acid. Alcohol in any form can impair the kidney's ability to excrete uric acid, leading to higher blood urate levels and an increased likelihood of gout flares. Distilled spirits, including whiskey, vodka, rum, gin, and tequila, pose a particularly strong risk because they are concentrated sources of ethanol. Wine, particularly red or dry wine, is generally considered less purine-rich than beer and somewhat less likely to provoke flares, but it is by no means risk-free. Even moderate wine consumption can destabilize uric acid in sensitive individuals, making both types of alcohol important to manage carefully for those prone to gout. The mechanism behind alcohol-induced gout is multifaceted. Ethanol metabolism produces acetate, which increases ATP turnover and enhances purine nucleotide breakdown, resulting in additional uric acid formation. At the same time, alcohol reduces renal clearance of uric acid, meaning the body cannot remove the excess efficiently. This dual effect creates a metabolic environment that is highly conducive to urate crystal formation in joints. Distilled spirits, due to their high ethanol concentration, magnify this effect, leading to sharper and more immediate increases in serum urate than many other dietary sources. Wine, while lower in purines than beer, still contains alcohol that can interfere with uric acid excretion. Some studies suggest that light to moderate wine intake may be less likely to provoke flares than beer, but individual responses vary considerably. People with gout often find that even moderate wine can trigger symptoms depending on hydration status, co-consumption of high-purine foods, overall uric acid levels, and metabolic health. This variability makes it difficult to predict a safe wine intake without careful personal monitoring and guidance from a healthcare provider. Wine can also contain sugars and additives in certain varieties, which may exacerbate weight gain or insulin resistance, indirectly worsening urate control over time. Beyond uric acid, alcohol introduces additional metabolic risks. Both distilled spirits and wine provide empty calories, contributing to excess energy intake and weight gain. Obesity and metabolic syndrome impair renal uric acid excretion, amplifying the very effect alcohol has on urate levels. Alcohol can also interact with medications commonly used to manage gout, including urate-lowering therapies like allopurinol or febuxostat, as well as anti-inflammatory drugs such as NSAIDs and colchicine. This interaction can reduce medication efficacy or increase the risk of side effects, further complicating disease management. Dehydration is another concern. Alcohol is a mild diuretic, and inadequate fluid intake exacerbates uric acid accumulation in the blood. Another important consideration is the context in which alcohol is consumed. Distilled spirits and wine are often consumed alongside high-purine foods such as red meat, seafood, or rich sauces, which compounds the urate load. Social drinking patterns, multiple servings, and alcohol consumed over consecutive days further increase the risk of acute flares and chronically elevated uric acid. Even small amounts of spirits or wine can be problematic if consumed in combination with other triggers, emphasizing that moderation alone is not always sufficient for protection. From a practical standpoint, alcohol should be approached with extreme caution by anyone with gout or high uric acid. During active flares, all alcohol, spirits, wine, or beer should be avoided entirely, as tolerance for purine and urate stress is at its lowest. Outside of flares, careful assessment of frequency, portion size, type of alcohol, and individual tolerance is essential. Some patients may be able to consume small amounts of wine occasionally, but this should always be discussed with a clinician and adjusted based on uric acid monitoring, overall diet, hydration, and comorbidities. Distilled spirits generally carry a higher and more immediate risk and are best minimized or avoided altogether. The nutritional value of alcohol is negligible, providing no essential nutrients and only empty calories, while introducing multiple metabolic risks. For individuals managing gout, prioritizing hydration, Low-purine foods and nutrient-dense beverages such as water, herbal teas, or fortified low-fat milk is far safer than relying on alcohol for social or culinary enjoyment. Even occasional indulgence should be carefully planned to avoid destabilizing uric acid and triggering flares. In summary, distilled spirits and wine are high-risk beverages for people with gout due to alcohol's ability to reduce renal uric acid excretion, promote purine breakdown, impair hydration, and interfere with medications. Spirits are particularly potent triggers, while wine may be somewhat safer but is still capable of provoking flares in sensitive individuals. Limiting or abstaining from alcohol, avoiding consumption during active gout attacks, monitoring uric acid levels, and discussing safe limits with a healthcare professional are critical strategies for protecting joint health, preventing flares, and maintaining long-term urate control. Social enjoyment and culinary appeal cannot outweigh the metabolic risks alcohol imposes on individuals prone to gout.